You self go be a boss. Amen. Amen. Every hustler getting paid. Where the hustle go come to pay. Your own in no go take. Amen. If you don't find work, do your own. God self go do his own. And flesh go cover bone. Amen. Amen. If you believe it, say amen. If you believe it, say amen. If you believe it, say amen. 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 Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Sister, where one man sings until where they find begin. One day you go born twins. Amen. Amen. They're not wait on losing job. Landlord come they do like God. One day you go be landlord. Amen. Amen. Good news go locate you. What you see in no go take. If you believe it, say amen. No. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Everything you put your hand go up. Your name go open doors. You self go be a boss. Amen. Amen. Long life go follow you. Strangers go favor you. Great men go honor you. Amen. Amen. One day you go sign the check. Oh. You self go drive that Benz. Oh. This life go still make sense. Oh. Amen. Your children go make you proud. Oh. Bad people no go pull you down. Oh. One day you go run this town. Oh. Amen. Amen. You self go spray me money. Baby go call you honey. You self go host the party. Amen. Amen. Dangote go be your friend. Otedola go be your friend. Adenuga go be your guy. Amen. Amen. Elubelu go be your guy. Abdusamad go be my guy. Rabbi you go be my guy. Amen. Amen. Your life no go end in shame. Your business go bring you gain. If you believe it, say amen. 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 Amen.
Ladies and gentlemen, Darling Clinic now.
A friend of mine has said a big no to the question, will you take the vaccine if it comes to Imo State? But what he might not have known is that the COVID-19 have contributed to over 1.84 million deaths worldwide and still counting, and that vaccine is what would help us all survive this. For over 1 year, the world has battled with the COVID-19 pandemic. This is actually a pandemic that a lot of us did not understand at the beginning. Even scientists were asking questions because it was novel, it was quite new. And then they kept asking questions, looking for answers, and eventually, got a solution, which is the vaccine. Good morning and welcome to Darling Clinic. My name is Certified Camille. How are you?
Good morning. And talking about vaccines, well, vaccination with safe and effective COVID-19 vaccines is a critical part of Nigeria's strategy to interrupt the COVID-19 pandemic and, of course, curb the transmission of the virus. And already we have received 3,900,000 124,000 doses of AstraZeneca vaccines in Nigeria. And according to the National Primary Healthcare Development Agencies, the vaccines will start going to states who are ready. And Imo State is one of those states. Isn't that awesome? My name is Cassey, the radio diva.
It's definitely awesome, Cassey. So we're going to be looking at the plans of rolling out this vaccine in the state. So if you have questions concerning this, you can send them through to us on Facebook, Twitter, and even our YouTube channel. We are currently streaming live, so go to that live stream and send us your concern.
And we have Dr. Sebastian Oku, who is a WHO Imo State coordinator right here with us in the studio. Good morning, Doctor.
Yeah, good morning, Cassey. Good morning,
have you
Camille.
here again.
Thank you. It's a pleasure.
All right. And we'll have Dr. Odom from the Imo State Primary Healthcare Development Agency join us shortly as well. Ask your friends to be a part of this conversation. They can find us online. They can listen to us from anywhere in the world. Just log on to www.darlingfm.ng and click on the play button. So, Dr. Seb, let's get into the conversation.
Thank you.
This friend of mine who has said a big no is an Imolite. So, want to start by finding out why do Imolites need the vaccine?
Well, Imolites need the vaccine because we are part of Nigeria, because the pandemic has touched every state in the country, Imo not accepted. So, if people are at risk of COVID-19, Imo citizens are also at risk of COVID-19 unless we do the right things.
No, okay. All right, so the federal government started rolling out of vaccines yesterday. I think Ogun State, they've gotten their own doses yesterday. So when is it arriving in Imo State? When are we getting our
Wonderful,
the flag
wonderful.
off?
The vaccine is arriving in Imo State today. Yes. So Camille, I know you've been interested in tracking the vaccine. So we'll call the state store so you can witness it live as it arrives.
Oh, great.
But it's actually being taken to Enugu State today by air,
Okay.
and then from there it will come to Imo State. But it will be in Imo State today.
Okay, I know that the last time you were here on the show, you talked about our preparedness, and you assured us that Imo State is prepared, which is what we are currently saying, because the vaccines are only released to states that are deemed ready to distribute these vaccines. Do you have any idea of how many doses we are expecting in the state?
Okay, Imo is expecting something in the region of 70,000 doses for this first phase, and Imo State is ready to receive the vaccines and to store them, keep them safe until people start to receive them. We've not rested since last week. Even over the weekend, we walked through Saturday and Sunday trying to make sure that everything was put in place. So we are ready.
Okay. All right. So I think it was last week I did a roving report. I went out to ask people, how they're concerned about the vaccine. And in fact, most of the things you were saying channel on the rollout plan. Some people are saying they've witnessed some things or occasions in Nigeria where the poor masses don't get these things, and the affordability. How is it going to also be available to people who, especially in rural areas and all that? And it's good to ask the rollout plan. How is it like?
Okay, thank you very much, Cassey. The rollout plan is a well laid out plan, both from the national to the state and to the rural communities. Now, the first thing we need to know is that the vaccine is in very short supply. And so countries all over the world, from the developed to the developing, have prioritized the people most at risk to be the ones to receive the first batch of these vaccines. Now, when we are done with those ones, then we now go to the next group of people. Who are the ones in phase one? Phase one are those frontline health workers, those who work in hospitals, be they private or public, who are the first contact of patients, who are the first contact of people who are ill. Another group of people include the security agencies. Another group of people are those that work at the points of entry, such as the airports, be they seaport, be they airport or land borders, because they come in contact with all kinds of people. Then Another group of people we are thinking about are the petrol attendants, those that work in the filling stations. It will surprise you that we're thinking about those ones, but those are the people that also come in contact with all manner of human beings on a daily basis. So for the phase 1, those are the ones to receive it for now. And let me quickly say here that the rollout plan is made with the best interest of Nigerians at the back of our minds. People should not think that, oh, they brought it, oh, it's going to be for a certain group of people, they are not going to give to us. No, it will get to everybody. There's a rollout plan running from 2021 to 2022. So people should be patient. But what I'll ask is, we should go out there and register, because for you to get this vaccination, Cassey, you need to register online. You need to pre-register. And we're not leaving it to the people to do, because we know that some of them might have the challenge of not being successful with the registration. And so the health workers are also there to help people, particularly those in the rural areas, with registration. So you can do the registration yourself, or somebody can do the registration for you. Okay. It's very easy.
Okay. I have actually registered.
Wonderful.
I went through the process, and I would actually say that it's quite easy. You know, the process of the registration process is quite easy.
Sure,
you know,
sure.
Anyone can get through. But I have a concern. Is it everyone who should do the registration now, or those who fall into, you know, the category, yes, of people who will get the vaccine in the first place?
Okay, everyone should go ahead and do the registration right now. But then, like I said, the software also has the capability to select those who should receive it phase by phase. So everyone should go out there to register.
All right. We're going to take your calls and comments. We see that you've sent in some comments on our Facebook.
I want to quickly ask Dr. Oko, the vaccine free? Is it free?
Oh, the vaccination is free. You're not going to pay anything. And let me say this, please. People should stick with the government supplied vaccines.
Okay.
All right.
Because you saw in the news already that Interpol is arresting some people for manufacturing fake vaccines, you know. So we should stick with the government supplied vaccines.
All right. So get the information on our website on www.darlingfm.ng and Facebook at Darling
107.3 Darling FM.
In accordance with the Nigeria Communications Commission, NCC's mandate to link every phone number to the user's national identification number, NIN, 9 Mobile as your network of choice is making the exercise nice and easy. Simply dial *996#, verify and link your NIN. Better still, you can visit www.9mobile.com.ng/NIN to do the same. Remember, a stitching time saves all the 9 Mobile benefits you've always enjoyed, so hurry now.
Healthy Kid is a baby and infant tasty liquid that contains 20 bionutrients including omega-3, choline and inositol for brain development, memory and learning ability. It also contains vitamin A, vitamin D3, vitamin E, calcium, iodine and amino acids. Healthy Kids improves immunity and strong bones. Healthy Kid is NAFDAC approved and marketed by United African Laboratory and is available at all pharmacies near you. For further inquiries, call 0806 465 4812.
Dada loves Healthy Kid.
Healthy Kids for your baby's general good health.
So this year when
ihe anyị na-achọsi ike n'uke elu dịzị n'ugbu a n'uke ala ya mere ụlọ ọrụ Imo State Health Insurance Agency na njikọ aka ha na ndị Imo State Primary Healthcare Development Agency ebidola idebanye aha ndị Imo State niile tozuru oke maka Imo Health Insurance Scheme n'okpuru Basic Healthcare Provision Fund. Ịnọ n'okpuru afọ ise ịbụ nwaanyị dị ime maọbụ ịgbaala karịa 65 itozuola oke ịnata ọgwụgwọ n'efu n'okpuru Basic Healthcare Provision Fund Scheme. Ị chọrọ ezi ndụ ịka nka na-enweghị obi ikonye n'elu ngwanụ were ọsọ ga-akpọtụrụ Primary Healthcare Center ọbụla dị gị nso idebanye aha gị. Chetakwa na ejighị ego na-edebanye aha maka ọgwụgwọ n'efu a. Na-egekwa ntị ka ị nwee ike ịmata mgbe ndebanye aha ga-ebido n'ogbe gị. Gọọmenti His Excellency Senator Hope Uzodimma ekeela ji n'ume iwetara ndị Imo niile nlekọta ahụike bụ kpoo ma bụrụkwa aka ruo nwa ogbenye. Ekwekwala ka ohere ọma gafee gị. Onye tinyere aka n'ọkwa bụ Reverend Sister Dr. Maria Yohanes Uzoma, Executive Secretary, Imo State Primary Healthcare Development Agency.
107.3 Darling FM,
the People's Radio.
One evening my father said, my son, I'm dying and soon I'll be gone. But before my final farewell, hear me and hear me well. Do whatever you want to do. Have a plan or roll the dice. But one thing is strictly taboo. Please follow my advice. Never Google your symptoms. That is my only prescription. You get 100 diagnoses, a medieval prognosis. Every sign is a serious condition. If you Google cough and diagnosis, you have got tuberculosis. And if you Google fever and red, you've got Ebola and soon will be dead. And if you Google I have a runny nose, it's CSF, your brain is leaking juice. And if you Google itch and prognosis, anaphylactic shock or psychosis. Never Google your symptoms. Seldom it brings any wisdom. You want to discover, but you might uncover that you have an extra chromosome. So this is what I heard my father say. And then he closed his eyes and passed away. The autopsy report was very clear. Death from hypochondriac fear, which is custom when you Google your symptoms. Never Google your symptoms. The hit list is never awesome. Pain in your left arm, heart attack alarm. Do you feel a little weak? Yes, you've got ALS. If you have a slight anemia, you've got leukemia. Are you a little crazy? You've got ADHD. So never ever Google your symptoms.
We are back to the program.
My name is Dr. Hyacinth Emele.
Dr. Mekamolisa.
Dr. Ngoka Stanley. I'm a consultant physician, nephrologist, and a member of the Infection Prevention Committee in Federal Medical Center, Owerri.
Dr. Hyacinth Emele. I'm a family physician with the Federal University of Technology, Owerri.
Dr. Mekamolisa. I'm a consultant pediatrician. This period will be really tough for parents having to stay at home with kids.
The coronavirus, also known as COVID-19, is real.
Even though it is not a death sentence.
So believe it. Even though the lockdown has been relaxed a bit, we need to remain vigilant and remain safe.
Please let us take responsibility now. Do it for yourself and the rest of us.
Put on your face mask when you are going out. Observe social distance as much as you can. Observe appropriate sneezing or cough etiquette, which involves sneezing or coughing into your bent elbow and a tissue paper, which should be discarded immediately after use.
And children will be children. They might not always want to do what you want them to do, and that can create stress. But then you need to be careful, because children are adventurous, because they are active. This is the period of home accidents. Burns from fires, falling down, walking through glass doors, even attempting to take your drugs. You just have to be careful.
Use alcohol-based hand sanitizers often, and remember to stay at home if you don't need to go out. Remember, the coronavirus doesn't move, it moves when you move. God bless.
to Darling Clinic Radio on the People's Radio, 107.3 Darling FM, 11:27 a.m. and of course Tuesday the 9th day in the month of March 2021. My name is Cassey, the Radio Diva.
And I am certified, Camille. You were going to introduce me, right?
I was going to introduce Dr. Sebastian Oko.
Again, we still have Dr. Sebastian Oko here in the studio, and we have Dr. Uche Chukwu Odom just join us. He's the Director, Disease Control and Immunization, Imo State Primary Healthcare Development Agency. We see all of your comments on our Facebook platform. We're going to start taking some of those comments now, right? While we still ask questions. Well, Adebi Rufus Chidebube on Facebook says, make them no sellamo. That's my own. That's his concern.
That's his concern.
All right, Donny P. Nyaka says, let them share it the way they shared our palliative.
Oh my God. Okay, so I think in the morning, during the Good Morning Aware show, someone actually said that about palliative and why they're saying let them share it the way they shared palliative. Because some people are saying some of them didn't get the palliative. Some local government, some community didn't get it. So they should go take it to the people that they gave palliative and all that. But hey, it's not palliative. This is about your health, and you need the vaccines for you to be, safe and of course protected.
Absolutely. So we'll give you a phone number because it's important that you get the information that you need and that you also ask questions. You can call in on 0815-050-1073. Hi, good morning.
Hello, good morning.
Good morning. Welcome to Darling Clinic. What's your name?
I'm Emmanuel.
Emmanuel, go ahead with your question.
Okay. Please, I want to know more about the advert just on in this field.
You want to know about what?
So concerning State health insurance stuff for
Okay. The advert on health insurance. That's not the conversation we're having, but we're going to.
I know. Then about the conversation, there has been a serious concern about the effect of the vaccine, and there's a person around about the vaccine. So I would like our guests there to share more light and tell people that it works. Then I will let the General Assessment Agency state as the vaccine is arriving today. Let them go on enlightenment advocacy. Then I know that they have been trying, but I have seen one of them in my church and the people. So I'll let them to
continue. All right.
Thank you.
Thank you, Emmanuel. All right, Emmanuel's major concerns are the adverse effects of the vaccine. Dr. Odom is the Director of Disease Control and Immunization, Imo State Primary Healthcare Development Agency. So I would like him to respond to that.
All right, thank you very much. Emmanuel, your question is very, very apt. And the truth remains that, one, before a vaccine of this sort is being moved to the public and asking public to actually come take it, it means that it has passed through rigorous testings. And then, NAFDAC, being our lead regulatory agency in the country, has actually done a rigorous job and at the end of the day approved the vaccine that it is safe. But be that as it may, just like other vaccines or vaccine-related campaigns, you cannot rule out that in the process of giving a vaccination, there may be some reactions which most times may be unconnected to the vaccine. So we call these adverse events following immunization. Okay, the state has also did a lot in that regard. When you talk about adverse events as concerns the vaccine, it has no known adverse effects. Okay. But for now, as you know, it is a novel virus and the vaccine is just developed, and over 50 million people has been tested. Okay, and then clinical trials also conducted. and we see that the vaccine is actually very, very safe and effective. So just to allay your fears, don't get scared, okay? The side effects, which may be as a result of maybe a coincidence, maybe somebody who's already having malaria or whatever, maybe after receiving the vaccine may think that it's the vaccine that caused the fever or thereabout. Sometimes some people may experience a kind of a pain at the injection site. All these things, we call them mild reactions, okay? So clinically, it has been confirmed to be safe and have no adverse effect. Thank you.
Okay. Well, the health workers are amongst the first, people on the priority list of getting the vaccine in the first phase. Are they also expected to register at the website before they can get their vaccine? The health workers in Imo State, Dr. Seb?
Yes, everybody is expected to register because the registration will ask you whether you're a health worker, whether you're not a health worker. So health workers are also expected to register. And when they register and they get vaccinated, is also uploaded to that server. So it helps us to track how many people have been immunized, how many people were registered, how the vaccine was used.
Okay.
So if they register, let's say they start registering today, and the vaccines, some of the doses will arrive today rather. When exactly will the immunization start? Dr. Odom.
Thank you very much. In times like this, as said earlier, this is a new vaccine. Okay, so it is being introduced in Nigeria. A few days ago, we all, if you watch at the national, the media houses, you saw when the president, okay, and then received his own vaccine, okay, and then it was launched at the National Hospital, Abuja. So we are going to replicate the same thing here in Imo State, okay. So for people to actually understand, and then for us to actually create awareness, so we really need to do some mobilization activities, just like I think Emmanuel mentioned about the Comos and rest of them. There are a whole lot of activities lying down, which will get towards flagging off this introduction in Imo State. And the flag off is slated for 12th, that's Friday, 12th March 2021. We're looking at flagging it off at Imo State Specialist Hospital, New Owerri. That's Friday.
Okay. And like you said, the president took the vaccine. That as as the leader of Imo State, that the governor is also going to take the vaccine at the flag off.
Yeah, definitely, it's expected that it will follow suit. Okay.
Okay. All right. So, Dr. Oko, there's something also I want to ask about this registration, because I had someone, I think the person, she comes out once in a while, to the town to do some things, and we were talking about this vaccine, and she said for people in her own community, there's nothing like data, there's nothing like network in terms of registration. And she said, how are we going to do this? Like, she's like one of few people who are opportune to even be coming out to town to do something and still go back there. So for people who are living in such areas, and you talked about you must register before you can be vaccinated, how would they do? How would they cope? How would they go about it?
Yeah, thank you for that question. In designing the registration platform, such challenges were taken into consideration. For you to register, actually, you do not need to have what we call network coverage or data on your telephone or on your platform, but you can register on the DHIS2 platform, which is the health information collecting platform, for the entire country. And then when you are in an area where there is network coverage, let's put it that way in quotes, then you can upload it to the server. So those in the rural communities who don't have network are not going to be left out. They will also be assisted to register.
Okay, so let's go to the comments on our live Facebook stream. Michael Chuk says he's watching live from Irete. Honestly speaking, the way and manner of this COVID-19 vaccination is not ideal. Michael, you have to explain to us what you mean by that. how do you expect people to register online before they will be vaccinated? Do we have internet facility in the rural areas?
So I think that's what Dr. Oku just answered. It doesn't need the data or something for you to do that. Okay, let's take this call.
Hello, good morning.
No.
All right, we'll call back. Bob Uche Singh, CK says, if we get vaccinated, should we stop wearing nose masks? No. Then if we get vaccinated, will it prevent COVID? No. If we get vaccinated, will it kill COVID? No. Please, someone should educate us here on why we should be vaccinated. All right. Dr. Seb, over to you.
Yes, okay. That's a very interesting question. So Bob Uche, your concerns are real, but the vaccine is one of those measures that will complement other measures to protect us against COVID-19. The vaccine itself is not a cure for COVID-19, but it helps you to fight infection stronger and better if you were to be infected after being vaccinated. And so we advise that in addition to being vaccinated, we have to continue to use or to adhere to all those other measures like hand washing, use of hand sanitizer, use of our face mask, maintaining social distancing, and if eventually because you can never get too careful. So if eventually you get infected, because you have been vaccinated, the effect of the COVID-19 on you will not be as severe as if you didn't have any protection at all. So it's a win-win situation for everyone. So if you get vaccinated, you're protected. If I get vaccinated, I'm protected. If you wear a mask, you protect me. If I wear a mask, I protect you.
All right. Odochukwu Gabriel on Facebook says, good morning, darling FM Uwere and Cassey, my radio diva. Greetings from Italy. Okay.
Thank you.
Have you gotten your vaccine over there, Odochukwu Gabriel? Would love to really, hear from you if you have. All right, 0815-050-1073 is the phone number to call if you have questions to ask, or go to our Facebook platform at Darling FM 1073. All right, we're going to listen to some health workers that we spoke to in the state. We asked them if they were going to take the vaccine and their reasons if they were not or if they were. Here's the response they gave to us.
Of course, I'll take a vaccine. Vaccines are meant to confer immunity on individual. There's nothing wrong in taking the vaccine. Of course, I'm willing and happy if I have opportunity to do so right away. Yes. My name is Dr. Dunga Kingsley. I'll take the vaccine.
My name is Dr. Hyacinth Emele, a past chairman of Nigeria Medical Association Imo State Chapter, a specialist family physician working with the Department of Health Services, Federal University of Technology, Owerri. I intend to take the COVID-19 vaccine as soon as it is made available to us. First and foremost, the vaccine is the only sure way of eradicating COVID-19 infection from the surface of the earth. This is because the disease has permeated into virtually all corners of the world. Secondly, as a health worker, we're in the front line of the fight against COVID-19, struggling to save people who are ultimately infected. In effect, we're closer to the disease on a daily basis than the rest of the population. Again, I will take it knowing full well that the vaccine has been declared to be efficacious and completely safe in human beings. The COVID-19 vaccine-related reactions have also been proven to be very minimal. Let's take COVID-19 vaccine and bid farewell to this worrisome pandemic.
Yes, I will take the vaccine. As a medical professional and a frontline worker, it's important that we avail ourselves of every opportunity to immunize ourselves and get some protection so that we're able to offer services as a when due while protecting ourselves and our loved ones and relatives at home. To also help us to open up the society and better protect the elderly and allow them to participate more in society. And I think it is a good thing that has happened, and even as research is ongoing about better options, at least it will help us to be able to do better.
Hello. Thank you for the question. I will definitely take the vaccine. Why do I have to take the vaccine? Because it is the way to go. The world has to move on. You need to be protected so that